Assalamu alaikum everyone, I hope you're enjoying good health. This is Mubarak Ali Khan again, and with me I have Mr. Munir, and he's a doctor by profession, and Munir is here at Gateway Sterling's IELTS branch and preparing himself for his OET exam, and he is a very hardworking and steadfast student. Some compliments for you initially so that you could speak better, okay? Last week, Munir and we were here so that we were mimicking out one of the role plays here, and today the same tradition goes on. This time, the format of this would be, we are going to mimic out a role play. Munir will be getting 1 minute to prepare. This is not standard operating procedure, but for the video, we'll do it. Behind the scene, he has prepared that already. And then we'll try to speak on that for 5 minutes, okay? Munir, are you good to go?
Yes, sir.
Right, so I'm giving you a minute to think about it, and meanwhile I'm telling to the audience that what we are doing. Okay, you please start preparing for yourself. Okay, so for the audience out there, what we are doing, it's going to be a role play in suburban clinic. The setting is suburban clinic, and the patient is 45 years old, and he has a disease called Alzheimer's disease, in which a person forgets basically. The patient is my mother-in-law, Mary Saas, and this particular doctor would be treating me. I would be encouraging him to give me sleeping pills or something because I want some rest. I am running a successful consultancy business, as I do already. So that's how the plan is, and let's see that how it goes. And before watching further, if you have not watched our previous section in which Dr. Munir and we have made our first video together, the link is up there on the right hand perhaps, or on the left hand, is your choice. I don't know where is that, but the card is there. Just click that out, watch our first video, and then come back and continue with us, and you will see the improvement Munir has done in last 7 days. And it says 1 minute gone with you. All right, Munir, please, you start.
Hello, good afternoon, sir.
Good afternoon, dear. Who's this?
I am your examiner today.
Okay.
My name is Dr. Munir. I am one of the registered doctor at this hospital.
Mm-hmm.
Can I have your good name and age, please?
Yeah, my name is Mr. Mac.
Okay, Mr. Mac. How are you feeling
I guess
today?
you mentioned my age as well, right?
Yes.
Yeah, I am 45 years old.
Yes, sir. Yes, Mr. Mac.
Yeah.
How can I help you today? And how are you feeling today?
Basically, if this question could have been asked a month ago, I could have said that I'm very happy having a good consultancy business and having 3 teenage children. So I was having a super happy life till my grandmother has entered in the house, and now we have a problem.
What seems to be the problem?
Actually, my grandmother has a problem. We call that Alzheimer's disease.
Yeah.
You better know.
Yeah.
By the way, do I exactly know? Would you like to tell me what is Alzheimer's disease?
Sir, Alzheimer. Briefly, I will tell you what is it. So, Alzheimer disease in which our brain not works properly.
Okay.
Or we can say a person who have Alzheimer's, he or she is suffering from low memory, or they are just losing their memory. So they can't remember what they should do, and they even can't recognize pupils.
Oh.
Yeah,
Okay.
they are going to have a short-term memory.
Yeah, this is what she's doing, by the way. You know, I have my full hour job. I'm running my own business, so it's not 9 to 5, rather it's 9 to 9 job. When I come back home, I see such drama in the house. She's roaming around, listening to nobody, taking no care of herself. Sometimes she does not know she has to go to toilet or washroom. So it disturbs the whole scenario, and my children are getting weak because of that too. Give me some pills so that I just stay away from that, because I have to go back to my work every day.
As I understand from your speech, Mr. Mac, I think you need some help to deal with your sleeplessness as well as your anxiety.
That's what I wanted. Why don't you recommend me some straight away, some sleeping pills, doctor? I am just sick of it.
It's okay, sir. Can I ask you, do you mind if I ask you, do you smoke?
Occasionally, once I'm sitting with friends, otherwise I don't.
Okay. What about alcohol?
Once in a blue moon, if there is some party or I'm going to pub or somewhere, but normally I don't do it.
Okay. How much you sleep, sir, and quantity of your sleep?
On average, I sleep around 10 o'clock, wake up around 6 o'clock.
Okay.
So I sleep for 8 hours.
What about these days that you have sleep?
Oh, you have just pushed me below the belt here, you know. I am not sleeping any further. My wife, she keeps on awakening up again and again. She keeps disturbing me with her too.
Okay.
Oh, you won't believe that one fine evening, my mother-in-law, she went out of the house and we had been searching for her around 2 a.m. in the streets. That where is she? So I do not sleep well nowadays.
Okay, sir. I'm afraid to say that, sir. To be very perfectly honest with you, I am not recommending you sleeping pills.
Do you think I'm a kid? You're not recommending sleeping pills too?
I am just explaining it for you, sir.
Okay.
I have to say that I mean you tend to be addicted to that sleeping pills, and this addiction will be very bad for your brain in long term. So I am not really recommending you sleeping pills.
You would be right at your end, but I know I'm a perfectly balanced person, and I am not the one who would fall a prey into addiction of anything, as I'm not an addicted smoker, or maybe I don't take wine quite often. I don't think it would happen.
Okay, sir. As you better know, sir, nowadays people want to manage everything, control everything, and be strong in every phase of their life.
Okay.
But sometimes these phases is difficult to get rid of that.
Yeah.
I mean that these in some phases of our life, that our brain, our body sends us some signs to change our lifestyle. Let me give you an example. If I pinch myself like this, right now my brain is telling me that don't do that.
Okay.
It's hurting you.
Yeah.
Do you got me, sir?
I understand. Yeah.
The same in your case, sir.
Mm-hmm.
You are just suffering from sleeplessness, and your body tells you that you have to manage your life and you have to change your life.
Okay.
Do you suggest me to stop pinching myself, or suggest me to suggest me to an analgesic for this idea?
I would go for the second one.
Analgesia? No, I don't think so, sir.
Okay.
I am sure you are telling me that you stop pinching yourself.
Okay.
In this case, sir, you are suffering from sleeplessness, and your body tells you that you are not managing your life correctly.
Okay.
Maybe there is some problems with your life. I do know your concerns, sir. I can sense your feelings. But there are some alternative ways you can manage your anxiety and sleeplessness.
For example, what I can do?
I can like self-care, sir.
Yeah.
You have to because you have to deal with your situation, and also taking medication is bad for your health.
Yeah.
You have to manage it. Like self-care, something like you have to do regular. You have to start some regular exercises, as well as some diets which is low in carbohydrates, and as well as you have to avoid taking coffee.
Okay.
And beverage, drinks, as well as wine and smoking. These things I'm sure that will help you very much.
But this is one-time thing. Would you be giving me some regular counseling or something, or?
Of course. Yes, sir. I'm just going to recommend you to go for a counselor with a psychologist.
Okay.
I will arrange it for you. I will write a referral letter for the psychologist, and then you will have some suggestions from them as well. What else can I say? Do you have any questions, sir?
No, I don't have any questions.
To recap, sir, I want to just summarize my speech with you. Just you complain from sleeplessness, and I advise you to don't take sleeping pills at all. You don't need that. You have to manage your life. You have to change your diet. You have to have a normal rhythm of sleepings, and make the environment that you live, make it a safe place, which is no noise about around there, and also I highly recommend you to use earplugs, which is very good for your sleeping. You will not hear any voices while you're resting.
Well, I guess to you it's easy to say, but I am suffering from something. But I'll try to take your remedies.
It's okay, sir. I grant you, if you follow our advices, you will definitely be out of this condition.
Okay. Thank you for your time, dear
Thank
doctor.
you, sir.
I'll visit you again.
Okay, sir.
All right. Going well. Oops. If I listen about your first interview with me, today I found way less time to speak with you. You were quite impressive as well as enthusiastic to talk. which is a beauty. And I am happy that last time I mentioned you about the recapitulation, I mentioned you about some pronunciation problems, but this day it went super well.
Thank you. So
Having said that, I'm all praises about the positives, but there are some negatives as well.
I know.
Initially, I guess maybe because of camera or something,
Yeah.
initially you take some time to get to track. And then the good thing about you is that you got to track. Normally people get distracted in the beginning and they cannot get onto track no matters what. But after a minute, I found you quite much into it. I would give this negative credit to the camera, not to you. I guess you could have done better if it could have been the other way. Other than that, your honest is still there. How do you pronounce this word? Honest?
Honest.
It's honest.
Honest.
Yeah, next
Yeah.
time it would not be repeated. I told you
Okay.
the other day too.
Okay.
How would you pronounce this word? Psychologist.
Psychologist.
Yeah, psychologist.
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 Okay. And I'm happy with the management today, by the way. You had been ticking out the things you completed so that you do not repeat them. And luckily, you did not go to heart attacks today. That's the best part. Normally, you go to heart attacks or such kind of things. I thought maybe the sleeping pills would lead to some heart attack or maybe some vascular pain or something. But this time, luckily or unluckily, you were not there. Other than that, I'm very happy that you touched upon all the points. You went super well. Recapitulation was an addition. If you would speak like that, inshallah, you will be getting your desired. Okay, I'm happy about it. How did you find Munir's video? Let us know in the comments so that we get to know and you may motivate Munir on that. Right, Munir?
Thank you, sir.
You have something to say?
No, thank you very much. Thanks for watching us.
Thank you for watching us, guys. Take care.